Dr. Timmerman, when folks come to day surgery, it's a little bit different than going into the hospital for a stay. What do they need to be prepared for?
They need to be prepared to come in a couple hours prior to surgery. They need to be prepared to be evaluated by nurses, have an IV started, be evaluated by anesthesia, and all that happens before they get a chance to see me. And then they bring them over to the holding area, and then that's usually when I ask them if they have any questions about surgery, go over the informed consent, make sure they understand everything that we're doing, and of course if they have further questions I can answer those questions at that time.
What are some of the most common questions that come up?
Well, through day surgery, believe it or not, the most common question is when can I go home is the most common question. Some other questions, might include some of the post-operative things. When can I drive? When can I take a bath? When can I take a shower? When can I eat? Exactly.
So what kind of different procedures are you involved with on a day-to-day basis?
I do. Well, I am a general surgeon, so that opens up a lot of different procedures for me. But I do colonoscopy and upper endoscopy. I do all different types of surgery, including surgeries in the chest and the abdomen. I do vascular surgery, and I also do some neck surgery.
Now, when we talk about coming in 2 hours early, obviously it sounds like there is a lot that goes on. Prior to that, people need to prepare and need to know things like when not to eat and how long to wait for that. And I guess that's all taken care of before they get to see you. All that information is given to them. That's
right. I mean, in the office, when they see me in the office, we usually prep them not to eat anything after midnight the night before, give them the time to come in. Some medications they have to stop, some medications they have to continue, and we try to give them all that information prior to surgery. And the hospital does a good job of having nurses call in advance and reiterate these things, so in case patients forget.
What do you do with someone who can't eat prior to or after midnight, and they may have some issues like, say, diabetes? What do you do for blood sugar issues and things like that?
Well, they'll get IV fluids when they come here and have labs, of course. But if at home, most diabetics know if they're hypoglycemic, which means they have a low blood sugar, and it's fine for them to have a sip of orange juice or something like that. The reason for not eating is not that it has anything to do with the surgery, with the exception of the colonoscopy, but it has more to do with the anesthesia. And when you're putting a tube down somebody's windpipe for the machine to breathe for them, the last thing you want them to do is to spit up anything or throw up anything, and keep it from going down into their lungs because they can't protect their airway.
Is it important if a person thinks they have a hernia for them to get it checked out?
It is, and typically in your annual physical examination through your family doctor, that's part of the sort of a comprehensive history and physical. And certainly if you have groin pain, then that's certainly the first thing to look for. 1 in 3 men in the United States will likely develop a hernia in their lifetime. It's the most common procedure that I do.
What usually causes that? I know lifting and doing things like that can cause it. But
that's exactly it. It's lifting and overexerting yourself.
Now, some of the other operations or procedures that someone might face while they're here.
Through day surgery? Oh gosh, there's an array of things. Just from a general surgery's perspective is all I can really speak to. The upper and lower endoscopy are certainly things that we can do in day surgery. Removing the gallbladder, fixing a hernia. Some lumps and bumps that people might have, masses on their skin or things like that, I can do in day surgery. When people hear about day surgery, they think they're going home the same day, but I'll send, for example, a colon cancer case through day surgery the day of surgery, and they'll come through that way, and then I'll admit them to the hospital post-operatively, but they're still going through all the same pre-operative things that the patients that are going home the same day are, if that makes sense.
Is that because is it a better experience, a more soothing experience than admitting someone into the hospital, or is it just for time constraints? What's the main reason?
I think it's just it's fluid, and I think they're so good at doing it over there, it's better than sending a patient to the floor, where nurses are busy doing patient care and things like that. The preoperative area is dedicated to exactly that, processing that person, getting them in the system, getting the IVs in, getting things started, and then getting them over to the OR for surgery. But it's just the anticipation of surgery is a fear for everybody, and in fact, if people come in relaxed, it makes me nervous. I like for them to be a little a little nervous and ask a lot of questions, and a good patient should do that. They should know what's going on with their surgery and understand the process, and it's my job to help them through that.
What happens in the preoperative stage if you're speaking with someone and everything's not exactly the way it should be? Do you reschedule it for another day, or how does it? Depends on
Yeah.
what it is.
No, sure, absolutely. If they come in, for example, and they take the blood sugar, it happens to be a diabetic, and their blood sugar is 400. You certainly wouldn't want to operate on that person that day. Abnormal is anything above 120, so you wouldn't want to operate on that person that day. You could reschedule them. I find that most patients are very happy. Some patients just can't wait to get out of here, and then there are some patients that would actually want to stay longer, which is a little funny to me, but they don't feel quite comfortable enough leaving in the same day, especially the bigger cases like hernias and gallbladders, not so much the colonoscopies and upper endoscopies. Lots of people come through here, they have gallbladder disease, a large fear of having their gallbladder out, which is an elective surgery in most cases, so it's not, I'm not saving their life or they're not in any danger. They've dealt with the pain of it. They get their gallbladder out. A week later, I see them in the clinic, and they're like, "Why did I wait 2 years to get this done? What was I thinking?" And most of it is fear of the unknown, or fear of having an operation, fear of having anesthesia, fear of being put to sleep.
And then when they get through it, it's like not so bad.
Not so bad. Yeah.
All right. Dr. Timmerman, thank you.
Yeah. Thank you.
Appreciate it.